Hello, everyone. Thank you for your patience. Thank you for coming tonight. We've got a lot of new tech and transitions, so we're working it out as best we can. Some things are working well and some not as well as we would hoped, but we'll keep on it and hope it'll be full featured in future meetings. We'll be using these microphones tonight so that people on Zoom can hear. If you'll be speaking from the audience, we'll provide you with a mic to speak with. So we have Zoom recording, AI summarization, and closed captioning initiated. Okay, great. This meeting's being video recorded and will be publicly available on V-MCC's YouTube channel. What's on my mind has been moved to the same time as new business. So we'll have more flexibility and possibly more time for that. I'll provide a brief technical overview. I'm going to move around and address the camera because our auxiliary camera is one of the things we don't have working tonight. No. Okay. Hi, everybody on Zoom and also in the audience. Let's use contemporary technology to our full advantage. If you're participating in person, it's perfectly acceptable to have your phone or other device open during the meeting. This can be especially helpful if you have difficulty hearing. You might log into Zoom for audio using earbuds or a headset at your preferred volume. The Zoom volume should be good because we're using these microphones tonight. Or if you have difficulty seeing the display screen, you might open the agenda link and that was sent out and zoom in on the document. You're also welcome to use your phone to look up relevant information during our discussions, if that would be helpful. Democratic Rules of Order summary and flowchart can be found at the link that was provided in the agenda. The flowchart and downloadable summary of the rules can be found on in the right margin. For those of you who are here in person, we have copies of the Democratic Rules of Order you can borrow or even take if you really want to study it over on the table there, along with some cookies, with which I hope you will help yourself. Please raise your hand to speak to a motion or participate in open discussion, and then lower your hand after you've been recognized or no longer wish to speak. The first time that you're recognized to speak, please identify yourself by a name. For Zoom attendees, if you've signed on with anything other than your first and last name, please change it to your first and last name. If you're participating remotely, sign in with a phone or a computer, not both. Stay muted unless you're speaking on Zoom so we can know who you are. Please be advised that questions on chat may not be answered. If someone wishes to take on the task of speaking for the person chatting, they're welcome to do that. Very well, the meeting will come to order, and first order of business will determine if we have a quorum tonight. The quorum is 25 voting council members minimum. If you've recently joined, you'll know your membership has been processed if you've received a welcome email from Debbie Jackson. Debbie's here in person to say hi. Okay, well, thanks for protecting us all, Debbie. I'll be helped by counting votes by Jen Hrachovec and Kavi Rana, or board secretary and a board member. And on Zoom, you can use the reactions button to raise your hand. And it'll help if you just raise your hand rather than giving us thumbs up or heart signs or something. Just when we're voting, use your hand raising, please. So only members can vote. We practice good faith voting, meaning that you're trusted to vote and do other formal business only if you're a V-MCC member. and those are the people who count toward our quorum. So if you're a V-MCC member, please raise your hand. Okay, we do not have a, well, so that I'll ask for the total. Total is 22, so we don't have a quorum as yet. So we'll proceed with our meeting as best we can. However, we won't be able to conduct formal business until we attain a quorum.
We've got two here, not sure how to raise our hand.
Secretary Jen Hrachovec, but these will be, until we attain a quorum, these will be a record of the meeting rather than formal minutes. We'll start with a welcome and a reading of land acknowledgement. And Brian Long, in the guise of Thomas Payne, has offered to do that tonight. Thank you, Brian.
Thank you. As I stand before you dressed in colonial garb, I am particularly humbled to read this land acknowledgement. This nation was founded on a genocide, partially unintentionally through disease, and unfortunately, partly intentionally. So we grow, we learn, we change, and we hope. Please join me in acknowledging the Coast Salish people. The land we occupy today is their ancestral land. For thousands of years, they lived on it, stewarding its resources with care and wisdom. And so today, with gratitude, we acknowledge them and their elders, past, present, and emerging, and recognize that this land remains a vital part of their cultural sovereignty.
Thanks very much, Brian. I'll briefly make some remarks on the rules of conduct. Our council is committed to conducting its meetings in a civil, respectful, and courteous manner. We expect all participants to demonstrate common courtesy and respect toward fellow islanders and guests. As we continue to build our new council, we are dedicated to creating a safe and healing space to address our shared interests. Rudeness, personal criticism, and ridicule, including in online chat contributions, are not acceptable and will not be tolerated. Please keep your remarks focused on the issues, not on individuals. Please ensure that everyone has a chance to speak before you ask to speak again. Only members can vote. As I said, we practice good faith voting, meaning that you're trusted to vote and make motions, second motions, and make amendments only if you are a V-MCC member. That will only be pertinent once we're in a formal meeting if we attain a quorum tonight. But please join me in a show of hands to demonstrate that your intent to honor good faith voting and the rules of conduct. Thank you very much. We're here because we're stronger together. We'll move directly to our island partner organization update. Tonight, we're graced with the company of some representatives from the Vashon Health Care District, Sarah Howard, who's the communications coordinator, and Tim Johnson, who's the superintendent. Thank you for coming tonight. Yes.
Oh, I get a microphone. Everything. I think I know how to work this one a little bit better than the senior center. Oh, okay. I see. Hi, everyone. Nice to see you. The last time I was here, there were quite a few less people in the room. So thank you all for being here. And I hope you enjoy what I'm here to tell you about. My name is Sarah Howard. I'm the communications coordinator for the health district. Do we have the slides intact, or is that okay? Before I get too ahead of myself.
Okay. Rather
Let's
wanna
use
announce?
this moment to do another quorum count. Our secretary has informed us she thinks we have a quorum now, which would be terrific. So again, everybody in the room who's a member, please raise your hand, and also on Zoom, if you're a member, raise your hand. And the vote counters, please be sure to count yourselves. Five.
Oh, yeah, 5
And
or 6 because Dwight has 2 people.
okay, so what is our total? 28. Wow, that's great. Thank you for everybody. And thanks for everybody who additionally showed up on Zoom. Yeah, let's have a round. I'm inclined just to let you proceed with your presentation.
That's okay, whatever you think. So we'll just start with the first slide. Oh, sorry, at the very top. Yeah. There's only 4, so we're not like reinventing the wheel here. There we go. Well, let's just start there. This is just hi. I'm Sarah Howard. I'm the communications coordinator for the health district. I am joined by our superintendent, Tim Johnson, who is going to join us up here at the end of this presentation to answer some questions. For those of you who are not familiar with the district, it was formed in 2019 to improve healthcare on Vashon. We do not directly provide services, but we rather partner with organizations that do. You can switch slide. Who am I talking to for the slide switch? There we go. Okay, perfect. So these are some of the organizations that we fund and work with. Youth and Family Services, you may know, provides vouchers for medical, not only transportation, but dental and medical appointments. They also have an intensive care a case manager, Journeymen. We utilize circles to help with isolation and loneliness. They do a man's circle and a boys circle, and through the Women Hold the Key, they also do women's circle for those purposes. Dispatch Health, you may be familiar with. It is our mobile urgent care unit that goes through insurance, and sort of their partner, very distinctly working together now, is MIH on the second side of that slide. When we get there, no worries, is Mobile Integrated Health, and that is an organization through the King County that works out of the fire department, and that is also a community-based care. It is a mobile service, and so they and Dispatch Health work well together. Dove Project has therapy vouchers for the public, also has a school-based therapist and works with behavioral health. And then the Vashon Senior Center is our partner. We all know the Vashon Senior Center, and we have a social worker there that helps with resources for our seniors. So these are our main partners that we work with, directly funded by the health district. The next slide, if you will, is a quick guide. So for those of you who have been to our website or perhaps came to our public forum in January that talked about all of the kind of the services that we have, from 911 to primary care to community-based care and urgent care and the pharmacy. So these are sort of our alliance that we have of medical care on the island. So 911, obviously, if you're not sure, just call 911. We are really blessed on this island to have not only the advanced life support, but the basic life support. So after insurance, you don't pay for an ambulance ride. So if you're not sure what ails you, just go ahead and call 911. They will send somebody out. They will assess what's going on with you. If it is not life-threatening or you do not need to be taken over town, then they will set you up an appointment with MIH on the next Monday, and you can get taken care of what you need to get taken care of. Where we want to start with our healthcare is with primary care. So we have CMAR, as you know, they're building a new facility here that should be open around September. There's a lot of information here. I don't have the time to give you all of it, but we do have the CMAR coming in September, and then Vashon Natural Medicine is our other primary care, and they are actively accepting new patients. So if you do not have a primary care, or you are ever interested in Vashon Natural Medicine, you might want to, this is a good time to check that out. Our next level is sort of the mobile integrated health and dispatch health. So mobile integrated health, they're both mobile. Dispatch health works more with like acute urgent care, and mobile integrated health does some of that work, but also post-hospital care. They have social workers that they send to homes if you're in need of resources or social work help. They assess fall risk. And so the mobile integrated health is paid for by tax dollars. So if you're underinsured or uninsured, mobile integrated health is a great resource for you. If you are insured, dispatch health is a great resource for you and does a little bit the acute urgent care things, lacerations. There is some overlap there, and they are currently working together to get patients what they need. You can find more information on our website, which we'll share in a moment. And then our last category is the pharmacy. The pharmacy, if you haven't experienced sort of what they, the work that they do in their clinical services, if you have like pink eye, if you're under 65 with UTIs or some of these other more minor ailments, the pharmacy is a great place to check out first before you go over town. So these are all great programs that you can tap into here. For a more in-depth version of this, you can go to our website, which we'll talk in a second, and we can click to the next slide, sir. That's okay. Yeah, absolutely. So there's a QR code for those of you in the room that can click it. Otherwise, you can go to vashonhealthcare.org. That is where you can contact us, ask us any questions that you'd like, which you're going to probably have some questions after this presentation. So I'll go ahead and start Tim up to the room. Perfect. If you go to the resource site on our page, so vashonhealthcare.org/resources, you will find that 5-part continuum, which is a more detailed version of the 5 entities that I just shared with you, their hours, what they provide and offer as far as healthcare, how to get in touch with them, their website, and all that information. So I would advise go to our website, vashonhealthcare.org, to find that. And also here at the bottom is for other questions. Always reach out to us at info@vashonhealthcare.org. Because we answer questions, I personally answer the emails, and we'll always try to help you find the resource that you're looking for. Do we have questions? Possibly. You have a question right here? Oh, I think I have this lady here. Hi. Or wait, it's the same question, maybe. Okay.
I have a loud voice. Okay. Okay.
Oh,
So I'm
Sue.
Joanne. So the senior center had a great social worker, but she actually moved. I don't know, did they get a new one yet? I don't think.
Actually, I was just at the senior center this week while they were doing interviews for
Oh.
hiring to replace that person. I know their decision, but I can't say what it is yet, other than yes, there will be a replacement soon.
Great.
Robin Stover, who currently
Yeah.
is the senior center social worker, has graciously been still working 1 day a week via phone, taking care of people all the way from Goldendale.
She's so great. So then I wanted to ask you another question. So the mobile health unit had a social worker, and then at the senior center the other day, a new person came and said, oh, they're the social. So do you have now 2 social workers or just 1?
Well, actually, we have several social workers, navigators, or case managers spread out among different communities. We pay for both the social workers at the mobile integrated health unit. We pay for the social worker at the senior center, and we pay for the case managers that are based out of youth and family services that help vulnerable families. Our intent is to get a lot of care navigation for people and target specific communities to make sure that we reach out to them, because sometimes the people who need the help the most are the least likely to reach out for it. So we're trying to find our neighbors where they are, which includes at their homes.
That's such an important job, social work. They do. They're amazing.
They do a lot. I just had a meeting with Lisa, who is one of the social workers for MIH, and she enlightened me on, a lot of the cases that they're seeing and things like that. So yes, specifically the mobile integrated health has two social workers right now. I think that was the beginning of your question. Yeah.
I do want to believe that the CMAR new facility will be ready in September, but I haven't seen a soul on that property in months. And the plywood is turning brown and the plastic is still, I mean, I want to believe that it's going to be done, but it doesn't look like it.
You're asking the number one question I actually get. You know, we no longer fund CMAR, but I get asked more questions about CMAR than any other health related thing on the island. I walk by that building every day because I like to walk around town to get out of my office. They are actually there. They're just not as noticeable. They're mostly parked in the back. For the last several weeks, they've been doing mechanical and electrical work inside. They put up the shell of the building and then closed it in with the idea of working on the inside through the inclement weather. Probably one of the last things they do will be put on windows and siding as they get closer to bringing in equipment that they don't want stolen. But they are working on it. I talked to Mary Bartolo a week ago. She's their senior vice president, and she said they do intend to be open by September.
Okay, thank you.
Thanks. I have two quick questions. I want to try to keep it focused to what you're here to speak about, which are sort of the partnerships. And so I'm sure there's a lot of questions about these two things, but in particular, I'm wondering about the former Vashon-Maury and what's going to happen to it, that old clinic up there on Ridge, whatever it is. You know, I just haven't heard about that recently. And I haven't heard whether you're going to be partnering, as far as you know, with the new Thunderbird Center that's opening in July. Can you speak to that?
Happy to answer both of those. I can't speak for Sunrise Ridge, but I do happen to know some of my other neighbors, a couple other members. I believe Youth and Family Services is one, who are chomping at the bit to get some extra space. They will be renting out part of the old clinic. Sunrise Ridge Board is intending to keep the property as a community resource. So they will probably see a lot of social service network agencies utilizing the space, because right now, if you go to the senior center or youth and family services, it's kind of no elbow room. To get the Thunderbird, we have reached out and talked to Thunderbird multiple times. They communicate with us occasionally. I'm sorry to say that it's been my experience that they were not very well received in our community. There was a fair amount of rude behavior, and they've been a little quiet about that, but they have reached out and told us that they are interested in working with other agencies. They've just been concentrating on getting their building up and running. I believe they're planning on opening in July. I do not know all of the services they will have. That's really dependent on how fast they can hire people and get things going, but they will let us know soon.
If I can follow up my own
Sure.
question. And by the way, I'm Lynn Kerrigan. I wanted to let you know that probably 2 or 3 meetings ago, we have actually been exploring with Thunderbird what their status is and how we can better communicate with them as they develop more of a presence here. And they said the same thing to us, is that they just have so much going on with the funding and the project development that they haven't been able to become part of the program. But who we have been linking with is the Friends of Thunderbird, who have under Liz Illig and Shelley Means been willing to kind of communicate with us a lot about kind of what they're doing. And they urge anybody who's around and interested to join friendsofthunderbird.org. And that way you can get current updates on everything they're doing.
Thank you. Nice to see you here, by the way. Teresa, I was like, I know her. We just met at the Ace Hardware. We were talking about birds and things, Lynn and I. So it's nice to see you. Can I ask you really quick while we have a little break to move forward so we can get you in the picture of the Zoom? Oh, I think that people at home would like that. There we go.
I have a really great face for radio.
Great. Well, we'll just keep it to more questions.
Mr. Payne.
Yes, it's sort of another CMAR question. We'll have a new facility soon, but will we have any doctors? They recently let the nurse practitioner go. Wasn't her choice. Don't know what might be behind that, but I know her contract was up or something. But now Dr. Erdman is also retiring. So is anybody left? Will we have any doctors on the island? Don't know exactly.
I don't know the exact date on that. The answer is I wish I could tell you. I don't know. They've had a lot of difficulty getting and retaining staff on the island for a variety of reasons, and I don't really want to go into any of those because some of them are part of the whole healthcare system and some of them are their own issue, and I don't take other groups' temperature in front of everyone else. They are recruiting more people. They're hoping to add behavioral health services in the building as well as dental services, which will be a huge boon to our community. They currently, Dr. Langland provides a lot of extra care to see patients that don't have insurance, and that will be really a great boost for him. Well, on that note, I wanted to point out that one question you haven't asked that I get all the time is why do we have two mobile services, Dispatch Health and Mobile Integrated Health? Dispatch Health came to us at the time when there was no such thing as urgent care at home. They brought it to our island. They have been taking care of us 7 days a week, 365 days a year for a year and a half now. And at the same time, we knew we would have some problems because they are a commercial outfit and they require insurance in order to be able to run. So we first did a few vouchers to get people care through there, and then we also worked with our mobile integrated health unit to stand up a unit that could see patients without charge. I'm pleased to announce that we are just starting to work on phase 2 of MIH, which will be adding another provider and getting them up to 7-day-a-week status and more services. We don't tell people outside of the community this, so please keep it to yourselves, but we're actually forming our own little kind of single payer outfit out there, and that single payer is all of you. If you live on the island, if you buy things on the island, if you visit the island, the taxes that come to the property owners on the island pay for that, and no one who is taken care of by MIH receives a bill at all. Zero.
Thinking back to the times when I've had an emergency with my health, I was too flustered to look at the page that I have with all these different organizations to make a decision. Is there one number that I can put on my cell phone that could be answered 24 hours that I could help? I'm Vashon Island at this address and this is what just happened to me. I don't know which organization to call.
Well, currently, if you're not sure what to do, we always give you 3 numbers to call, 911. Don't be shy to call 911 if you're having a problem and you don't know whether it's an urgent care, you don't know whether you need emergency care. Those medics are paid for by your taxes. They will come out and see you. If you need to be transported to the hospital, they will do that. If you do not need to be transported to the hospital, they will make sure that you have access to resources you need. Otherwise, if it's just a standard thing, we ask that you would talk to your primary care physician. They're your best first line of contact when it comes to your health care. We are currently working towards bringing a consulting nurse or some other resources available that people will be able to call to ask these types of questions ahead of time so that you know where they're going. But we've been running, in case you haven't, been running really, really fast to get the care on the ground first. And now kind of the other resources around it are coming. That's why you see Sarah here, because people got tired of hearing just me talk. So I brought somebody in who was much better to listen to.
Well, yeah, I didn't exist a year ago. Oh, a year and a half ago, or in this position. But I will say part of the 911 too is calling the 911. They'll triage you. So it's like you don't call 911 and then they just like come out. They'll talk to you and see like, oh, you're probably fine, or they'll assess the situation. and set you up with a mobile integrated health. And even if they come and your situation isn't as dire as they thought, then they'll leave, not charge you, and set you up with a mobile integrated health appointment. So you really can't lose. Just be on the safe side and at least call them and they can assess the situation.
Okay, so when you call them and
Yeah.
you tell them your location, then they would transfer you to someone who deals with the Vashon area?
Well, the 911 will go directly to.
They'll generally send out the fire department to you.
By the fire.
Oh,
And they'll
yeah.
go, oh, you have a blister, you're probably okay. Let's get you MIH on Monday. Or you have a blister, it's probably okay, but you sound like you're concerned. Let's go ahead and send somebody out. And then they'll come out and check it out and go, you're probably okay. Let's set you up with MIH. So either way, you get some advice on the phone. Although it is true that we have looked into, having a consulting nurse, which would be really amazing to be able to tell folks where to go. So that's just a process. And we have some, does that answer your question? Is that helpful? Keep
Yes,
going if you have more.
It sounds so distant, remote, like how would they know what's available on Vashon? How would they know to send to me?
Yes, yeah.
That's the job of the 911 dispatchers. They are trained when your call comes in, they know where you're calling from by GPS and location. And you also should tell them you're on Vashon because that's helpful. But when they send somebody to respond to you, it'll be a local Vashon service that responds to you. There was somebody in the back that had a.
Oh.
I'm going to just go ahead and give it to this fella because he'll be next.
Oh. Okay, I just want to mention that there's a dementia work group that started on Vashon, compliments of Andrea Avni and Indivisible. They have some policy action groups. And I wondered if there's any discussion in the healthcare district or your partners about specifically dementia care and long-term care on Vashon. I know that the replacing the nursing home is pretty expensive, but I think there's a lot of people that have an interest. So.
Well, first, the bad news. The nursing home's not coming back, and neither is another one. One of the first things we looked at as a district was whether or not we could get into care for our older adults. And we realized that given our funds and our ability to provide services, the best way to do that is to provide services to people to keep them in their homes longer. The astronomical cost of running a nursing home just does not work on Vashon. It took the community millions of dollars to keep that one open, and eventually one organization ran off with those millions of dollars and sold our building. I'm grateful that somebody is using it for a great purpose, not their fault, but we're not going to have a nursing home. The district is working really hard to figure out what we can do to further home care and care for people who need those resources. We just lost one of our commissioners, Wendy Noble, to a wonderful effort she's now a part of, the Old Friends Club, that's providing some respite care for people who are doing caregiving. They do that every Wednesday. And we're really interested in moving into a sphere where we can do something about that. It's just we had to start from a priority, and our priority was making sure everybody of all ages has urgent care, and we're working our way out. So we are definitely talking to a lot of people about it all the time, at least until I can't remember.
Okay, thank you.
And the lovely Liz Ilg is in the building.
I'm trying to wrap my head around all this. So first, a couple of clarifications. Mobile integrated health is the one that's associated with fire department. Is that right?
Correct.
Okay. And are you funding both mobile integrated health and dispatch health?
Yes, we originally approached the fire department to do urgent care as a walk-in service. The last fire chief was unfortunately not interested in partnering with us. So we went out and we found urgent care and brought it onto the island. Our goal has always been to do it as locally as we can. So as we've moved forward, we are now partnered with the fire department. The fire department would not be able to provide this service without the extra funds. We are funding the personnel that provide the MIH services so that we can utilize that fire department resource and provide that level of care. In this coming year, or actually within about 6 months, we're going to be deciding whether or not we can do all of our urgent and community care through MIH, and we may only end up with one provider. Our contract runs out with Dispatch Health at the end of this year.
Okay. And so,
Sorry for the long answer.
Are there things that Dispatch Health does that cannot be dealt with through mobile integrated health?
Yeah, that's a very good question, and part of the reason why we started with Dispatch Health. In the beginning, there were many things that Dispatch Health did that the mobile integrated health unit couldn't do. Number one, they could operate 7 days a week. Number two, they had broad medical capabilities. But as we've added those services on to MIH, that's become a smaller and smaller list. Currently, the things that Dispatch Health can do that are not able to be done by MIH at this moment are point of care quick labs, which is a really great service. They can come out and do lab tests right there with you and get you results the same day without having to wait a day to go home. That we're working on getting that capacity for MIH. And that's part of the reason why we're moving in that direction, because as long as there were things that Dispatch Health could only do, we've continued to keep that contract. But as soon as we can stand up our own, we've committed to being totally a local organization wherever we can.
I would certainly encourage you to follow that path.
We are not only following it, we're cutting down the bushes on it right now as we speak.
That's a really great analogy. Working through. I had Lynn and then this gentleman and then, well, this gentleman's up. Are we running out of time? Fair. Okay.
Kevin Jones, Indivisible Vashon. There's much to be thankful for about the state of healthcare on this island over the course of the last 5 years. So thank you so much for that. I did want to amplify the dementia care question that's come up. With the Equity Committee, which I chair of this council, people did talk about the ability to live their lives here on the island. And the statistics, as you probably know, around dementia care are startling, and particularly with our age demographic. So I appreciate the references to the Old Friends Club. Wendy Noble was actually at one of our meetings we had to discuss this issue just recently. I'm curious, as you talked about prioritization, I guess before I ask that question, people who are caring for those with dementia usually can't show up at a meeting like this because they're caring for people at home with dementia. And so how are you outreaching to folks to gather information about the nature of the challenge here on the island? And are you satisfied with the progress that's being made? And in the prioritization scheme that you mentioned, where does dementia care fit after the top priority that you mentioned with urgent care?
Sure, that's a long list of questions. I will try to get to them all for you. We are currently using a lot of different modes of finding out information. We use county resources to tell us statistics and numbers of people. We have people like Wendy Noble who meets up with me regularly and reminds me of, we're doing this, we're doing that. There are folks like Liz Ilg that we talk to in the social service network that we're getting information from. And that's also part of the reason we started our social work with a senior center social worker. Our first social worker was placed in the senior center, and a huge amount of the work that they do are helping the adult children of folks with dementia and aging issues in order to get access to services. Where it stands in our priority is kind of a difficult lift. We, to begin with, had some really big priorities in terms of making sure that we had urgent care and then spreading out some other pieces. In the middle of doing that, a gentleman with really bad hair stepped up onto the national scene and changed our entire focus to, we had to suddenly build capacity. One of the things that I do every day is catalog what's going on at the federal, state, and local level to make sure that our capacity building would provide some health care for everybody if everything went crazy, if the clinic closed, if Medicare shut down. So that's why we put a lot of our interest into the MIH unit because it's local. It's funded totally by our dollars, and therefore we can ensure that it will be here in the absence of other funding. Dementia care is really important. It's also really complicated. It's complicated care. One of the reasons that nobody's getting it is because there's no system really in place to do a lot of help. And on an isolated island with spread out smaller populations, we're still trying to figure out how to address it. The last thing I want to do is go out and promise people that we've got you until we know what we're doing. I will promise you we are working on it. It is very high on the priority list, because the older and more vulnerable people in our population are the first people we care about as a district. That was a goal that these commissioners gave me, was that we were going to deal from the vulnerable outward. And like I said, we now have medical urgent care for anyone on the island who needs it, regardless of their ability to pay. And we'll continue to expand services. This is not a sales pitch to you. I get up every day because keeps me sane doing this. So.
If I could just piggyback on that too, we have monthly meetings with MIH, and since they've had their, well, previously one social worker and now two, I'm able to meet with them every month and get an idea of what they're seeing. And they're actually out there in the community, going in homes to sometimes isolated people, sometimes folks who their neighbors are calling that maybe there's an issue next door or other things like that. So they're really able to see what's happening with these isolated folks that the rest of us might not ever know. And so that has been a really important like data point, and just sort of like nuance and subtlety of knowing what's happening in these places, and like how widespread of the issues that we have to solve.
That's why we're coming out to meetings like this, because you folks know people that we won't reach or that our services won't reach. And we invite people. We have a website. We're easy to get a hold of. I will meet you for coffee on a drop of a dime. One of the great things about having a local taxing district is that your money stays here, but also we're accountable to you. You are not some number to me. Every patient and constituent on here is my neighbor. So please, if you think we're not hearing from enough people, send them our way or send us their way. We will go.
Well, on that note, I'd like to wrap it up since they can get in touch with you and have coffee. Yeah.
So you all can just have coffee.
Thank you, Sarah. Thanks, Tim.
Thank you.
We'll back up now to approve the minutes of the last meeting. Can you bring those up on the screen, please? The April 16th previous council meeting. These were sent out with the agenda. I hope you've had a chance to review them. Jen, would you like briefly hit the main points of these minutes, please?
Yes, so we had an island partner organization update from Vashon Youth and Family Services. We passed a motion urging King County, well, we decided to postpone indefinitely a motion to end deportation flights from King County because of kind of legal requirements of that airport. We passed a motion advocating for safe renewable energy. Sorry, my computer is plugged in, and so I can't face you and read this at the same time. Advocating for safe renewable energy. And we had a bunch of announcements. Those are the highlights.
Thank you. Is there a motion to accept these minutes as drafted? Jeff Thompson has moved it and Evan seconded. Is there discussion or amendments? Dwight, your hand is up. Do you have something to say, Dwight? Dwight's hand is down, so I think maybe he did not have something to say.
Just wanted to second it.
Seeing none, we'll move to a vote. All in favor of approving the minutes of the April 16th, 2026 meeting, please raise your hand. Okay. And all those opposed? So what is the final vote, please? 23-0. The minutes are adopted. Thank you. We'll next move to approving the agenda of this meeting, May 21st, 2026. Again, this has been sent out in advance. I hope you've had a chance to review it. Is there a motion to adopt the agenda? Jen has moved to adopt it. Is there a second? Kavi seconded it. Is there discussion or amendments? Seeing none, we'll move to a vote to adopt this agenda as written. All those in favor, please raise your hand. Keep your hands up, please. $19 + 5. Jen, what's the final vote, please? Although, to ask for those opposed, Okay, now the final vote, please. 24-0. The agenda is adopted. Thank you all very much. I'll give a brief introduction to rules of procedure. We use the democratic rules of order. Again, there are copies on the back table if you'd like to borrow it, or even take it with you to study if you're really into such things. It'd be great. Unlike Robert's Rules of Order, which some of you might be familiar, we just make, with democratic rules of order, motions are made and amendments may be offered, but it's one at a time. There are no amendments to amendments. Again, only members may make motions or amendments. An important, there's an addendum here, want to advocate for change, make a motion in the V-MCC. It's attached and it gives you ideas of a lot of things that can be done in our community council other than just making motions. And I encourage you to read that and think about possibilities. I'll say, I'll interject. There's a lot we could do as a council that hasn't been done yet, but is entirely possible. Like if somebody did some amazing thing and you want to vote them an accolade or recognize them, we could do that. If something terrible happens and you want community council to express their sympathy, we could do that. You could move to reach out to other organizations or any number of things. There's some discussion about maybe having sister islands or sister communities. If you have ideas about that, we could explore that. So let's think out of the narrow box and think about how we can use our community council to be the fullest fledged organization it can be. It's important that you understand about making points of order. I do the best I can, but I do make mistakes from time to time. And if you're a member, you can rise to a point of order if you think I'm not doing something right or anything is out of order in the meeting, in which case I'll make an initial ruling, but that can be moved to be overturned. Ultimately, the authority lies with the council. If you're a guest, you're welcome to participate in our discussions, and you can rise to a point of information, as also members can, if you'd just like some clarification about what's going on. It's important that everybody be brought along, that we all understand what's happening. So please don't feel apologetic. If you're confused, you want to rise to a point of information, ask what's happening, where are we? Please explain that last thing. or whatever it might be. As they say, if you have that question, probably other people have the question too and haven't spoken up yet. So it's really to a benefit to everybody if you ask for clarification if you need it. Are there any questions about any of that? Yes, Joanne? Yeah, please. Can you make a point of information to someone?
Yeah, I want to compliment someone in the organization who's here today.
Well, you can certainly compliment them, but not just like rising up in the middle to give this extraneous compliment.
Oh,
It's
no,
pertinent.
this will be brief, but I can wait. I don't know. I'm not
Well,
used to
there is a time for announcements at the end, and that'd
Oh,
probably be the
cool.
most appropriate time for general
you.
accolades. Well, thank you.
Cool.
Anything else? Yes, Jeff? That is being moved this month to new business. Those are being combined. We're going to try that out.
Oh, okay, so that'll be later.
Yeah,
in the
after old
meeting.
business, we'll move to what's on my mind and new business. That
Okay.
way, we don't, if what's on your mind doesn't necessarily need to be limited, so time limited as it was before. And also it gives us a chance to talk about new business that maybe is less formal than people usually associate with that.
Okay.
Any other questions? Are there questions on Zoom?
Nothing in the chat.
Okay, yeah, Will? Yes, that is our plan.
When you look back and say, hey, look at all the things we did. We did the Joe Yarkins thing with the SEALs. Do you do an annual review of the things that this body has considered?
Well, that's a very good question. I'll point out that attached to the minutes and to the agenda, there is a table of those that we pull it through. So we keep a running list. And then we have our annual meeting in November, and that's a natural time to reflect on our accomplishments and challenges as well. And also, I'd say that in my monthly president's report, I also highlight the accomplishments of the most recent period. Are there questions? Very well, let us move on to old business. At our last meeting, the council moved to discuss the unauthorized use of the V-MCC email list. So that was in effect just to put this discussion on the agenda. I have a couple of things to provide by way of context, and then we'll move into the discussion. The first is a memorandum of the record I wrote shortly after this incident happened on April 7th. It's not too long, so I'd like to read it to you so that we're all on the same page about that. As I say, it was April 7th, 2026, by me, J.C. Graham, V-MCC President, having to do with the events of April 2nd through 5th, 2026, involving V-MCC Board Member and Vice President Nicole Anya. At the regular meeting of the V-MCC Board of Directors on Thursday, April 2nd, 2026, Board Member Nicole Anya moved that she permitted to send her United Humanitarian Protectorate document to the V-MCC email list. As chair, I ruled the motion out of order as non-germane and outside the scope of our community council. Nicole then moved to overturn that ruling, and her motion to overturn it died for lack of a second. Following adjournment of the meeting in private conversation outside the Land Trust building, Nicole stated to me directly that she no longer cared about following procedures. She also asked me if she should resign. Nicole had access to the V-MCC email list through her ordinary board duties. In particular, she was responsible for sending out a fundraising appeal letter and the April Council invitation letter. She did not send either of these, however, missing the deadline for the invitation letter. So the V-MCC Secretary, Jen Hrachovec, sent it out on Sunday morning, according to our pre-established process. On Sunday, April 5th, 2026, Nicole used the V-MCC email list to send a communication from her own organization, the Beacon Initiative. The email was addressed to dear members of the Vashon-Maury Community Council. She introduced the letter While I serve as Vice President of the Vashon-Maury Community Council, I am reaching out to you here in my personal capacity through my independent work with the Beacon Initiative. She included a link to the United Humanitarian Protectorate document. This memo is prepared to create a contemporaneous record of these events. Following our council meeting, where the council decided to discuss this, the board met May 7th to consider these matters. One thing that transpired following our discussion is that the board moved to recommend to the council that Nicole Anya be removed from the board of directors. That was unanimous except for Nicole, who did not vote. The board also moved that Nicole be removed as vice president of the organization. Both the motion to remove an officer and also the motion to remove someone from the board is done in 2 successive meetings and also takes a two-thirds majority. The board can remove someone as an officer, but it is only the community council that can remove someone from the board. At this point, I'm opening the floor for discussion or motions, and also any questions will all be considered under the same discussion format. Joanne?
I can't claim to know Nicole really well, but I remember having a meaningful conversation with her, I don't know, maybe 6 months ago or something. And I don't know what. Okay, so I'm just going to say it. So at that time, she told me, and yeah, she was living in her car. And I just want to say when she had mentioned that she wasn't so much for the procedural part of these meetings, right? I feel the same way. I feel the same way. I'm trying to be here at times or see how I can fit in or whatever, but I feel the same way. And when she told me she was living in her car, I was like blown away. So I'm assuming we're going to have some kind of vote here, but I just thought I needed to say that. I hope it's okay.
Thank you, Jan. Debbie, did you wish to speak to this?
Yeah, just real quick. I knew Nicole a little bit. She seemed like a really great person. However, as a member administrator, I think that's what I'm called, I feel like it's super important to be careful of the mailing list and not use it for personal use. And as a member, I wouldn't want my personal information shared with other people. So it has nothing to do with Nicole, but I think you did the right thing that you had to do under the circumstances.
Thank you, Debbie. Julie?
I'm going to need your help with this because I'm very sympathetic to the hardships many of us face, and the complexity that brings us into some of these hardships. I actually have, I don't know how to say this. Nicole is not here to defend herself. So I'm not sure it's appropriate.
As a board member and officer, Nicole would be expected to be here. She is still both. And I did express to her in numerous channels of my hope that she would be here tonight. But please go ahead.
Okay. This is a hard thing to do. I have some evidence that is unrelated to the council that Nicole was a very talented, very intelligent woman. Did something not unlike this in another context a while back in service to her own agenda. I don't feel like I can say what it is, but I remember red flags going up after I tried to help Nicole following a protest. And I thought perhaps she was in pain. And I didn't know her. That led to a conversation, and that led to her sending me some information. I too am good at doing research on the internet, and I followed through on it and found something quite disturbing that suggested a hack. I'm not going to go into what it was, but I'm happy to discuss it. I do not, I will say when this comes to a vote, I will probably vote that Nicole be dismissed, and I'm very sad about that. Quite sad.
Thank you, Julie. John, I'm going to ask you to wait till everyone's had a chance to speak who wishes to speak. I also, I meant to ask for help watching Zoom. Would you read that, please? Can you see it?
Dwight commented in the chat that his understanding of the use of any organization's mailing list is that it violates state law, and there are strict laws about member lists. And this was something that was raised in our last board meeting as well. That is not only a violation of our protocol, but it's a violation of state law. And so that piece does seem germane. So that's what's in the chat for now.
Thank you, Dwight, and thank you, Jeff. I need to clarify that while that is indeed germane, this is not a proceeding of law here tonight. This is a proceeding of our organization to determine if the judgment that was evidenced by Nicole is appropriate for someone we want in a leadership position. We're here simply to decide the matter of our leadership as a board member, and we don't need to get into the legal details, but it certainly is relevant. Yes, Mike?
So in your reading of your memorandum about what you experienced, to me the most important thing that kind of compels me to have an opinion about this is that it's clear that Nicole knew that she needed the permission of the board to use the mailing list, and came to the board and asked for that permission, didn't receive it, and took the action anyway. And to me, that's the core issue of this matter.
Thank you, Mike. Kevin?
Yeah, thanks, JC. I guess what you did clarify that Nicole is still a board member and that she is still the vice president of the V-MCC.
That's correct.
And you, I think, introduced this as a discussion of the situation that is in front of us. I don't understand if you have or have not proposed any action to be taken, other than I think that the board voted, or the majority of the board said that Nicole should step down. So
no, that wasn't exactly it. The board voted to make a recommendation to this council that the council remove Nicole from the board of directors. That would require a motion of someone in this council.
Okay.
Please go ahead if you have
Got
more
it.
to
Okay, I think that's clear. So so we're having a discussion about the board's recommendation that may lead to a motion for this council to agree with the board's recommendation that Nicole step down.
What point of information?
Yeah.
We also voted as a board to remove her from the position of vice president of the board, but that requires 2 meetings to become effective. So that also is in process, but it would not be able to take effect until the June meeting, if my understanding is correct.
Yeah, that's right. And Kevin, at the last council meeting, this council voted to add, in effect, to add this matter to tonight's agenda to discuss it. So this discussion is not necessarily limited just to the board's recommendation, though that's a very salient aspect of it. And you're right that the council essentially has the choice before it to take the board's recommendation and to move to remove Nicole from the board of directors or not to do that. That's at this council's discretion. It was
Okay.
just a recommendation from the board.
Okay, great. Appreciate the clarification. So my understanding is we're here as a council to discuss the situation, which may lead somebody in this room in the council at some point in time to raise a motion that Nicole be removed from to raise a motion to basically approve or agree with the board's position.
No, it's really, I wouldn't frame it that way, Kevin. It's not moved to agree with the board's position. It would be, in effect, accepting the board's recommendation, which would entail moving to remove Nicole from the board of directors.
Got it. Okay, thanks for clarifying.
Yep. Joanne, let me see if someone else wants to speak. Yes, Brian?
Hi, I do not know Nicole and do not know the organization that she was supporting. So I kind of speak as a disinterested party in that regard. I will say that in these times, we as individuals may reach conclusions that the rules be damned, the law be damned, I need to act in a certain way. And yet, perhaps we could even sympathize with Nicole or be proud of Nicole, depending on the view of what she was fighting for. But when you do that, you have to accept the consequences. And if you have deliberately gone against the consensus and rules of the organization, then it's not appropriate that you continue as an officer and board member of that organization, in my opinion.
Thank you, Brian. Also, I should probably add that both at our board meeting and privately, Nicole has been invited to resign, but has not availed herself of that possibility. Is there further discussion? Is anyone on Zoom?
No additional comments.
Oh, yes, please. Thank you for your patience.
Okay, good points you just made there, Brian. I want to say I wish I knew what the organization was that she was a part of or what she was promoting. I have no idea about that, and that concerns me.
I can tell you, would you like, shall I just tell you?
Well, 1 second. And then also, oh God, now I kind of forgot. Go ahead.
Oh, it's the United Humanitarian Protectorate, which is in effect a constitution for a global overarching organization to protect people's rights. It would be above all governments.
Oh, sounds good to me. I just want to say, I feel badly that she's not here and that she hasn't submitted a statement. And I also want to say that, there was reference to some knowledge of who she was and some reference to hacking. And that really bothers me because I don't know where to put that. And it just seems, I don't like it. I don't like it. Anyway, that's it.
Thank you. I understand. Really, I suggest we should base this on what we know for a fact, what Nicole did in our organization, and whether or not we think that's appropriate, and whether or not it's sufficiently good judgment by someone in a leadership position or not. Just like, even though this isn't a proceeding of law, like hearsay evidence doesn't have much evidentiary standard. Yes, Jen?
Just a nod to Nicole's expertise. There have been 4 of us that are working to replace her typical role leading the IT at this meeting. So she's incredibly talented and has done a lot for the council. I think the question that I think about is given the breach of using the mailing list for unauthorized purposes, if we do nothing and she retains access, are we at future risk of future things happening? And would that harm the credibility of the council within the community where people ask to unsubscribe. And like, it's a level of, do we feel that we need a risk mitigation strategy?
Thank you, Jen. Jeff?
I'd also like to say, as the newest member of the council or the board, I was present for the proceeding when Nicole was in the room and was given the opportunity to justify her position. I didn't see any acknowledgement of the transgression, which concerns me. But I will also say, from a human aspect, I believe she's going through a very challenging and difficult time. So as a human being, my heart goes out to her. And I think that this is one of those situations where we have to make our choices as human beings as to how to care for another member of our community. But that does not, that we also have to protect the integrity of the board and the collateral that we're entrusted with, which is the mailing list. That is really the matter here. So I think we have to take action to protect the integrity of the board. But I hear the heart of the people in this room that are concerned about this individual's well-being, and I am too.
Thank you, Jeff. Yeah, I would just like to inform you also that after our proceedings at the board, I told Nicole that I very much hoped that she would continue in her role as IT person. She's been extremely helpful to us, and that regardless of what happens, I still continue to think of her as one of us, and she was appreciative at the time. And I'm disappointed that she's seemingly withdrawn, but perhaps she'll have a change of heart in that manner. She's made many valuable contributions, and I would prefer to be able to emphasize those. Is there further discussion? Yes, Joanne?
I just want to say that I appreciate your comment and that information. I think it's important. And I also, you mentioned that she seemed to be under a lot of stress at this point. Okay. I get that because I've been through a lot myself lately. And it's amazing how off balance you can become. And I mean, I totally get that. And I like to think that human beings are open to hearing people in those places and helping them in some way. So I'm still voting for her. Sorry.
Yes, Ike, could you get a microphone, please, Ike?
Thank you. I'm Ike. I'm on the board, and I've sat through all of this, and I think that the board has been measured and humane and logical and sequential, and has followed all the bylaws of the council in dealing with this problem, which to me is a breach. Apart from what Nicole is as a person, we're not talking about, in my opinion, Nicole as a person. We're talking about Nicole as a vice president of a community organization with a very high standard of accountability to everybody that was on that email list, and by extension to the entire island and to the entire future of this community council. And regardless of what we feel about her or what her position is or what she's going through, she had the opportunity to address this to the board. She had the opportunity to say, I'm under a lot of stress. I regret having done that. Perhaps it would be best for all of us if I stepped away. And she would have gotten complete support from all of us. And she was given the opportunity to do that on several occasions, both privately and on the board. And she did not take advantage of any of those opportunities. And I think, to me, it's a very, it may not sound like a simple matter, but to me, it's like someone hijacking a plane. And for whatever reason they were hijacking the plane, could be a very strong humanitarian, world-shattering, beautiful reason, but they have taken on a responsibility that no one else gave them. And that's, in my opinion, what we're trying to deal with as humanely as possible, so that we can get on to other things that are, in my opinion, equally as important. but will be facing us in the future. And the sooner we get past this, I think the better it is for everyone, including Nicole.
Thank you. Mike?
So first, a point of order.
Yeah, what is the point of order?
Typically, don't we usually have a discussion of something, but you have to wait to the next meeting to take action? Is that how that works?
Well, substantive motions are introduced at one meeting and then action is taken at the next meeting. You're exactly right about that.
Okay.
There's been no motion made as yet.
Right.
What happened at the last meeting was simply to put this on the agenda, to have this discussion.
The same time to remove her from the board. And that's going to take some skill to craft that motion. And I'd be perfectly happy to make a motion to remove Nicole from the board, but I think that's half the story. And so the question is, how on and put someone in a position to write a well-measured version of that strikes both ends of this issue.
I'll address that, Mike. This is going to take considerable follow-up in any case. Nicole at our board meeting said she would sign something that says that she's destroyed all copies of the mailing list, both on personal devices in the cloud and in MailChimp, that she's not conveyed it to any other persons, and so on. And for legal reasons, we at least need to provide her with that form. Another motion that passed at our board meeting was to send out a letter of apology to our mailing list as a whole, which I'll need to be drafting. Now, in any case, the board will be sending Nicole a certificate of appreciation for her many contributions. This hasn't been mentioned tonight, but many of you know that after half the board resigned at the end of 2024, there were only 3 board members left. They put the council on hiatus. Nicole, as vice president, served as chair through the board meetings for at least 4 months, maybe 5 months, and basically led the way on pulling the organization through until the spring when I joined and was able to pick up the torch on that. The community owes her a huge debt of gratitude for that. The community council does too. And as I say, I would prefer just to be emphasizing those things and the many contributions she's made with IT also. In many ways, she's done an extremely creditable job, and I'm proud of her. That said, this is an organization of procedures. It's set up to be fair and legal, so by following procedures, so everybody gets treated fairly. And especially for our board members, and especially for our officers, they need a commitment to procedures. And the integrity of the organization depends upon that. And once people start like breaking the rules because they feel they have a moral claim to step outside of it, that's just a slippery slope to everything falling apart in my mind. We really need to be and also, I'll just say too, that one of the first things I did as when I came on was we adopted operating principles of the board, which Nicole voted for, and which holds us all to the highest ethical standards. And to me, that's critical that we do stay at the highest ethical standards. And when that doesn't happen, there needs to be accountability and changes made.
So does
Please.
the board have them.
Hold on, please. Let Mike finish his statement, please do. I'll recognize you in a second. No, I think Mike is still speaking.
So.
Well, I was
Does the
answering a
board,
question.
Put together a resolution that they would like to put in front of the council at this point?
Oh, it would just take someone saying, I move to remove Nicole from the board of directors of V-MCC. That it could be as simple as that. Joanne?
Okay. Well, just nothing personal, okay? I'm real opinionated, so. I just want to say, comparing what we're going through here with someone who's going to hijack a plane, that's extreme. That's my feeling. Nothing personal. But I want to say, from what everybody's saying, that were the rules and, we have this in the procedure, and what I want to say to everybody in the room, let's all think about what we have done during Trump's rule. What have we done for our country and standing up, and what's going on in our country, and what have we done to really try to make a difference and hold people accountable? Come on, people. I mean, get over yourself. It's like, okay, I understand there's procedures, and she made this agreement. We acknowledge of what she did, and how intelligent she is and everything else. But when we say, well, we're going to give her this certificate, I'm not saying that's wrong, but we're going to give her this certificate of appreciation or whatever, and we want to acknowledge her. But are there other ways to actually give acknowledgement of an individual who we know has gone through a lot of stress and maybe made a bad decision, and maybe she can't quite put it together, publicly about what she did, how it affected the group? What could people do to give people grace, so to speak? For God's sake, I don't know if she still is, but she was living in her car, okay? I mean, I just don't buy it. And especially because of what we've all been through as a country, and how we've seen that, for example, the Democratic Party couldn't stand up for anything, and a lot of fakery and a lot of dishonesty and everything else. But all of a sudden in this room, around this one incident and this one person who is different, she's different, okay? We're gonna like crucify her over it, so to speak. Well, you're out now, and oh, you broke the rule. Come on, look at what Trump is doing and all these other people in government. Get real. I don't accept it. Sorry.
Thank you. Thank you, Joanne. I'll recognize you, but I ask that we keep this as focused as possible on the matter before us.
I would just like to make a motion that Nicole be removed from the board of directors.
Thank you. Is there a second? Mike Dawson, second. There's a motion on the floor, so we'll move to discussion of this specific motion. Jeff?
I think in light of the corruption that we've seen at the federal level, it's even more incumbent upon us as stewards of an organization to bring the highest level of integrity we possibly can. And this is a matter that is this is an exact replica of some of the corruption we've seen at the federal level. This is a violation of state law. It's a violation of policy. It's a violation of the trust. And it's a person who admittedly said, I am not willing to follow procedures. And I believe that in her heart, she believes that what she's doing is the moral high road. And I applaud anyone who has that level of integrity as a human. But as a member of this board, I can't in good faith feel like I'm part of an organization that operates with integrity and honor if we allow such a transgression to happen. Regardless, if it was me, the same conversation should happen if it was me, or if it was JC or anyone else on the board that abused the privilege of being a steward of the resource of our mailing list and our confidential information to our members.
Thank you, Jeff. I'm going to suggest that we move on. This is the first reading. That motion's been made. By our rules, bylaws, this will come up again next month for our further consideration and decision. We have other very important matters to attend to tonight. Can everybody live with that? Debbie, I see you on the edge of your chair.
Question about what can we do for her? Find out from her what is the United Humanitarian Organization that she was so, so much wanted to support, and find out about that. And you could even bring that to the council. Maybe there'd be a group that wants to rally around that topic, whatever it is. So
Thank you, Debbie. I'd like to move to a happier matter of Jeff Thompson here has been elected by the board as our newest board member. Now, the bylaws are set up in such a way that ideally we have 12 board members. It stipulates that the first 8 will be elected by the board and then the council. The remaining 4 are just elected by the board, who has the latitude to elect board members to meet particular needs that they see. Jeff has been elected by the board, therefore he is a board member now, but the way I've been handling this for these additional board members is to ask the council to confirm their election so that we're all on the same page and the council has a chance to be introduced to the newest board member and ask them any questions and express any reservations they might have. So Jeff is with us here tonight. He's already been a great help to us, I will tell you. And Jeff, I invite you to introduce yourself to the council.
My name is Jeff Thompson. I have been visiting Vashon now for about the past year. My daughter and grandson, and as well as her mother and my grandson's father all live on the island. And so Meg's mom, Kim, is a lightning rod, and she's kind of drawn us all here. And long term, I think we all would love to be living on a nice property, a little compound together. But I'm currently renting an RV. I've been a resident of Vashon since May 1st, so I think I broke some records with being the newest, the least amount of living time on Vashon before becoming a board member. But I am passionate about recovery and mental health, and I'm passionate about food security and food scarcity. And I have, since I've been here, I've been working at Thriftway. I've interviewed with the Vashon Food Bank for a position for the summertime, and I've also interviewed at Thunderbird Treatment Center for a role there. And I've been hounding them, and I had a 4-person interview yesterday at Thunderbird that went, I think, really well. And so I'm fingers crossed about that. But yeah, I'm available to answer any questions about my qualifications or anything else that you have.
Could you say a little bit about your background with nonprofits, please?
Sure. So I spent 6 years in Tulsa, Oklahoma, working for Mother Road Market, which was a placemaking and a philanthropic initiative focused primarily on reducing barriers for people that were launching new food businesses. So it was a food hall that kind of served as a umbrella, sort of like a mall where you have guaranteed foot traffic. And so it allowed people to have a little bit more of a stable business model for, a lot of restaurants fail in the first year. And so this was a way to kind of stabilize that model. In addition, we were doing a lot to revitalize Route 66. The area in Tulsa where that was on 11th Street, and it was a depressed area. And so we did a lot of placemaking initiatives. I also served on the board for the Kendall Whittier Main Street Association, which won a Main Street Association award in 2022. One of the best Main Street organizations in the U.S. And again, focusing on placemaking and focusing on equity, focusing on reaching marginalized populations and giving them access to business ownership as a pathway to participating in their community. I worked many years ago, I worked for Fair Start over in Seattle. So I've had a lot of experience in the food service / hospitality / nonprofit space, and that's really kind of where my wheelhouse has been. Yeah.
Thank you. Are there questions? Kevin?
Thanks for the background and welcome. So JC knows that I'm on about sectors, of which there are, I think, a dozen of them. And I think one of the things in the bylaws that is now introduced by the Equity Committee is that people who want to be on the board will be asked about their interest in which sector they would like to be a liaison for. So I'm curious which of the sectors do you feel that you will step into as the sector liaison? And what are your thoughts about what you might work to accomplish in that sector? And how do you anticipate going about understanding what's the issues that that sector faces so that they can be brought into this forum?
It's a great question. I have volunteered or been voluntold, depending on how you look at it, the sector liaison for recovery, which is a subset of the healthcare sector. So focusing on recovery resources and kind of understanding the network, and in addition, food security and as part of quality of life sector. And so those would be the two areas of focus for me, given that I have a background in that area. And I've also made fairly deep connections in the recovery community here on the island. I was on the radio on Tuesday, Voices of Vashon, for their Adventures in Recovery program, and was able to talk about that. And really, in both of those sectors, my goal for the next several months is to be a sponge, to drink from a fire hose, as they say, attend as many community and organizational meetings as I can, and begin to learn what the gaps are, what the needs are on the island. I will share one anecdotal piece that I feel like adds value and is relevant to this body, which is at my interview yesterday. I didn't know until I was on the radio on Tuesday that there was that the Thunderbird Treatment Center, the TTC people, had experienced some lack of receptivity, for lack of a better word, to their venture here on the island. And when I presented it to them, and I said a lot of the native islanders have not embraced this idea, and I want to lean into the role of being an ambassador, especially if I go to work for that organization, right? And they said, well, wouldn't it be interesting if we change that language and acknowledge that we are the native islanders? We are the first peoples, right? And so we spent this wonderful time reading the land acknowledgement here, and we see these signs that this very building puts out, the land acknowledgements of the true owners of this land. And indigenous people are not well represented in this room. And so I think that just those types of nuances are things that I wasn't sensitive to. I'm now being exposed to as a result of just beginning to be a voice in these and an ear in these conversations around networks and resources and where are the gaps, you know. But ultimately, but the question I want to answer 6 months from now is, I've identified these 5 gaps in our safety net for Vashon Islanders, and this is the work that we're doing to shore up those gaps.
Thank you, Jeff. Also, I'd add that Jeff already has attended the Vashon Social Services Network Community Partner Meeting representing our council, which I appreciate. Are there other questions before we move on? Very well. Is there a motion to confirm Jeff Thompson's election to the board of directors? Joanne? And seconded by Eben. Is there discussion? Very well. All those in favor, please raise your hand. All opposed? Avi, Jen, you see any opposed? What is the final vote, please? 26-0. Congratulations.
Thank you. Thank you.
We have some time for new business. Julie, did you wish to make a statement? Yes, please, we do have another important new business item, so just.
I do
don't
have new
overlook.
business, and I'm Julie Brown. You've been listening to me now months talk about ending the deportation flights at King County International Airport. I've been a member of Indivisible Vashon, and I sit on their policy action team. I have good news, and you had asked for updates going forward. We have submitted an appeal letter, an urgent appeal to Attorney General Nick Brown to stop the flights. The letter was delivered on May 1st, hand delivered, date stamped, and it was accompanied by some documents, including a copy of the 1948 Instrument of Transfer, is a big part of the current legal issue with the airport. We're going forward now as fast as we can. Once you submit an appeal to the Attorney General's office and it's been dated, it's sitting there. It's in what they call a public comment period. That period will continue indefinitely. It's a strange situation. The urgency is there. We have the FIFA games coming in June. That's a week away. We want to get as much comment to the Attorney General's office as possible. I've got a few ways to make that easy for you. You can email, you can call and leave a voice message, or you can actually write a physical letter. Some people might even choose to deliver it in person. That actually makes impact there. This is being handled at the Attorney General's downtown Seattle office. It's on 5th Avenue, 800. I have information at the back. If you don't want to take the time, I also have a sign-up board. You can leave me email address. I will tomorrow morning send you an email with documents that sort of walk you through the process of commenting. There's some, they're not really script ideas. They're ideas for ways to approach this because it is a complicated issue. For that reason, and for the fact that we know things are going to get, ICE is going to become much more present in the month of June. And that may not ever go away after the FIFA games are over. We really need to get a volume of comment to the Attorney General's office as soon as possible. No, there's no deadline except for you making comment and speaking up. I'm assuming all Democrats in this room, Democrats in the sense of people who support a just democracy, and we need to actually act to get this to move forward. Otherwise, it's just going to sit fallow in the office. It's not going to go away, but it's not going to move forward either. So sign up, and I can also, I suppose, take a few questions.
Yes, that'd be fine.
But if you really want to get into the weeds with me, you're welcome to leave me your email address. Yes.
Yeah, we'll take a few questions, but we need to keep it short.
I wanted to thank you for that. That's really important. Good for you. And thanks for bringing it up.
I think you'll find there are a lot of people who are doing things.
But I just want to say, I personally, I just kind of resent the thing about all the Democrats, like we're the ones that, no. Sorry, I'm done with Democrats. And there's many other people under other titles that are much more active and honest and whatever than the so-called Democrats.
Are there other questions for Julie?
Yeah, thank you. Thank you.
I'll recognize Jen Hrachovec.
Thank you. I would like to make a motion to write a letter of support for a grant that the Department of Natural Resources is applying for. Unfortunately, the deadline is tomorrow. So usually when we're making a motion, we like to submit a motion 1 month and then vote on the motion in the next month. And that gives people the opportunity to comment or to show up at the meeting if it's something that's important to them. If there's an emergency timeline, we have the ability in our bylaws to pass something with by a 2/3 majority. So if we were to write a letter of support, we would need to kind of invoke the 2/3 majority. So the purpose of the grant is to support the growing of eelgrass around the Maury Reserve, which is, I'll use this handy dandy map. So Washington State has a natural reserve managed by the Department of Natural Resources that's in this area. The Land Trust helped to establish it. It means like we can't do things like develop docks around this area because of it's there. We're supposed to be supporting wildlife. So they have identified that there are a number of like there's trash that's in this area of portage that they want to remove. They want to study this area that was filled between Vashon and Maury Island and find out if the closure of that area is contributing to poorer water quality in Innermaster Harbor. And they want to look at historical documents to build a timeline to compare activities that happened in Quartermaster Harbor to the loss of ecological diversity. So they're applying for like an internal state grant from Mike, maybe you know more than I do about this, but it's for an ESRP grant, and that is issued by the Washington State Restoration and Conservation Office. So like it's a central grant processing group within Washington State. So they will move forward with the grant application with or without our endorsement. But if we vote for an endorsement, that would look favorably to the granting agency, I believe. Let's see. So they're going to remove debris. They want to evaluate how water quality and restricted tidal flow correlate with eelgrass losses. They want to establish a current baseline of eelgrass area to compare with historic data and analyze long-term trends. The information will be aggregated from the Department of Natural Resources, King County, and published reports to identify likely eelgrass stressors. They're going to hire the University of Washington Salish Sea Modeling Center to do a state-of-the-art model of flow patterns and water quality evaluations in Inner Quartermaster Harbor. And especially like model what if the portage area were not filled, what would be the impact on water quality. And then they will take the results and discuss them in stakeholder workshops to identify socially durable steps toward long-lasting eelgrass recovery. So their primary intent is to bring back the eelgrass. And eelgrass is an indicator species. If the eelgrass is doing well, it means there's good oxygen in the harbor, the herring are coming in, the salmon are eating the herring, the orcas are eating the salmon. So it's kind of at the bottom of the food web that things have to be doing well ecologically in order for that to be coming back and thriving. So that's their primary focus and measurement. So I move that we write a letter of support, and I've just summarized that.
The motion is to write a letter of support for this grant proposal to try and enhance eelgrass by removing debris and doing research and modeling. Is there a second? I'm going to recognize Sue. Seconding. Is there discussion? Oh, sorry. Thank you, colleagues. I was clueless. It's been moved and seconded that the council approve writing a letter of support for this grant. Is there discussion? Debbie?
Yeah, I'm not against a study, but I am not supportive of voting on it right now and say yes or no, because the letter says the Vashon Community Council supports this, and I don't know, there's a lot of people that haven't even heard of this or don't even, they don't understand the issues involved. So I would prefer to see the what is it, DNR, go ahead and apply for a grant, and then we study it a little bit more, get more information, and then maybe in another month or so, perhaps send a letter of support.
Thank you, Debbie. Are there questions or comments? Mike?
Here we go. I would support the motion, and if we don't take action, we don't have a voice in this process. The letters are due tomorrow, right? And I think gathering good information is the key to making good future decisions about, Quartermaster Harbor. And so, I would urge folks to vote to pass the resolution tonight and move the letter forward.
Thank you, Mike. I would entertain a motion to accelerate action on this, which would require a 2/3 majority vote of both the board and the council. Is there such a motion? Mike moves it. Mike Dawson, is there a second? Kevin Jones seconds. Is there discussion on whether to accelerate action on this? Now, if we accelerate, the way I'm doing this is we're just voting now to accelerate action. This is not a vote on the motion. It just gives us the possibility of passing or defeating the motion tonight rather than next month. Kevin?
I'll just speak for what I know. A lot of what Jen talked about is just the tip of an iceberg of a lot of coordination within the community about the value of this moving forward. So while I appreciate, Debbie, your comment about it would be wonderful to have more information, I hear that there's urgency, and I believe it's important to our community, our ecology, and I think what I'm seeing here is that this is to propose supporting a study. And I agree with the previous comment that data is good and we should move forward.
Thank you, Kevin. I suggest we move to a vote on the matter of whether or not to accelerate action on this. We'll first vote on, unless there's objection, we'll first vote on it by the board. Does the board members have any questions or comments about this? Okay, I'm looking now to board members to vote on whether or not to vote on this matter tonight rather than waiting a month. This is our custom. And on online we have Ann Thorne. Is that it? Okay, so all the board members who are in favor of accelerating action, please raise your hand. Okay, 6. And all those board members opposed? Oh, that's everybody. So it does attain the 2/3 majority of the board. So now we'll move to the council. All those on the council who are in favor of accelerating action on this item, please raise your hands.
$18 in the room and 6 on Zoom.
So 24, right? Mhm. And all those opposed?
Oh, Frank is on Zoom. He's opposed, so we have to.
How do we know Frank?
Because I see the chat.
Jackson here in the chat.
I see him in the chat.
Frank Jackson here opposed.
Okay.
White says there are 2 there, so there's actually 4.
25-4.
Is that correct? 25-4 and 2 against? Well, that is obviously 2/3 majority is attained to accelerate the vote. Thank you. So now we'll move to further discussion of the motion, if there is any. Yes, Julie? No, the way we're doing it under democratic rules of order is more just we want to emphasize everyone having a chance to speak. Yes? What is your name, please?
I'm Sharon.
Oh, hi, Sharon.
Sharon Price.
I live on that inner Quartermaster Harbor, and it's not just the eelgrass that's gone, the oysters are gone. There used to be enough oysters that there was a commercial business coming in there. And I used to have them on my beach. Not anymore. I think it really does need to be studied.
Okay, thank you, Sharon. Could you hold that till next month? We're going to have to take, no, we're going to do it tonight. Go ahead, Will. I'm sorry, I got a little confused. No, you can ask a question, Will.
Nothing. Does this have anything to do with the filling in of Portage way, decades ago? Because it used to be an estuary, yes? And it flushed out Quartermaster and kept it, cooler, fewer jellyfish, all that kind of thing, right? Okay, I've just needed a little understanding. Thank you.
Could I have a motion to extend our meeting for 10 minutes, please? It's been moved and seconded. All those in favor of extending the meeting, please just say aye. All those opposed? Okay, it's extended until 9:10. Thank you. Brian, were you going to say something?
I would just say that there's factors like closing the flow, but with climate change and raising temperatures, that also adds to the problems. So the more flow you can get through there, you get less warming of the contained water.
Thank you, Brian. Is there further discussion? Debbie?
Have you seen all the wood that collects at Portage? What I'm curious about is how they would actually do that, and about the birds and the frogs and all the other, habitat that's been created in the last 100 years. I don't think they filled it all in. But at any rate, I think we need to think really carefully, and that's what the study's for, I assume, to think carefully about if we're doing this, if it's a good, how this would be done, how it would be, going to take a bulldozer and dig up Portage. That will really help it a lot. Yeah, there you go. But I'm just curious how I'll be doing it. I'm not against the study. I just think we're rushing it a bit.
Oh, thank you, Debbie. Yeah, we won't resolve the matter of Portage tonight, but we can vote or not to send a letter of support for this study, which will, as Mike said, give us more information.
And also
Jen?
clean up some derelict vessels.
And cleanup of derelict vessels. Is that what you said? Is there further discussion? Anybody on Zoom?
Yes, I'd like to speak if I can.
Seeing no further discussion.
I think Frank is trying to speak.
Oh, are you trying to speak, Frank?
Can you hear me? Can you hear me?
Frank, turn off your mute.
I've got mute off, but I don't understand. Can you hear me now? Well, that's okay.
Whoops. Oh, no.
We've just turned on the TV.
Can you hear me now?
Oh, my goodness.
I am.
Frank, we cannot hear you for some reason.
I don't understand that either.
There. Okay, now we can. Say where you are and talk.
Okay, I'm Frank Jackson, and I am in an unusual position. For 50 years or so that we've been around, I've always supported the, eelgrass is really important. I agree with that. But there are some issues here that what I've heard tonight don't reflect understanding of the situation. And I've always tried to help people understand the futility of that and pointed them to for example, the King County study that has 9 different options from, a tube that goes under and does it. But if you get a chance, I just ask you to I know you've already decided to wait on this, but drive by, look at the situation, look at what you're hearing from the people in this room and presenting this, and see if it agrees with what you see. I don't believe it does. And I guess to keep things short, JC, I've been president of the community council also back in the 1980s on our Sarco smelter issues and land planning, and I understand you have to move the meeting, but I very much disagree with this. And you don't need to move fast. If they have a good study, it'll work. And if they have some slant that doesn't make any sense and causes them to do things like make artificial reefs with tires that probably do more damage than good, and like Montana's Flathead Lake where they introduced shrimp and doesn't, they essentially eradicated the kokanee salmon. Well, these are smart, well-meaning people who did the wrong thing and moved too quick and made a mistake. And I believe that you taking this action of moving forward so fast is a mistake. Thank you for the chance to speak.
Thank you very much, Frank, and thank you for your service to our community.
To clarify, this is a motion to support there being a study, yes? Okay, so there seems to be some confusion that we're arguing about bulldozing Portage or something today. We're not. This is just saying we should look into it, like the dynamics of the ecology and how it could be improved.
Thank you, Evan. Julie?
So as I read the letter, I'm not sure, it doesn't seem clear to me that this is a letter in support of a grant to do a study. This reads like a letter in support, and I'm not sure who's getting the grant even. The first paragraph doesn't seem to have I guess you'd call it an antecedent. On behalf of the Vashon-Maury Community Council, I am writing to express the council's support for the State Department of Natural Resources Restoration Program grant application. We're applying for a grant to actually do something to protect and restore eelgrass in Quartermaster Harbor. This is not a study then. This is a grant to do something, as I understand this letter. Is that correct, Jen?
The applicant is the Washington Department of Natural Resources, and the grant, the agency that would give the money is the Estuary and Salmon Restoration Program. And what the project is, I mean, they would do something, but what they would do is the project. And it's described in the letter below that there's part of it is the removal of debris, and the other part is the synthesis of environmental data. And the synthesis of environmental data is pulling together reports and trying to correlate activities in Quartermaster Harbor with the loss of eelgrass to try to understand some correlation so they can reverse the clock and get the eelgrass back.
Right. Yeah. Okay.
And part of that is a study of the impact of the Portage closure. So it's hiring the University of Washington's modeling team, the Salish Sea Modeling Center, to model what it would be like if Portage were back to historical levels from 130, 140 years ago.
Don't have the history. How long ago was the Portage put in? How old is the Portage? 1915? Okay.
The first pressure to open it was in the 1920s. So yeah, I believe it was in the early 1900s.
Okay, thanks. All right, thank you.
Thank you. Mike, did you have something?
This is one state agency requesting a grant from another state agency. So DNR is asking for money from the Washington State Restoration and Conservation Office. They regulate grants throughout Canada, both to state agencies and to private organizations to do various restoration work. So
It helps. Thank you, Mike. Kevin?
There's a lot of words in the first paragraph. I think the ones that resonate with me are that this council enthusiastically supports the grant application. I believe, Jen, that's what we're asking us to do.
Okay, thank you, Kevin. I'd like to wrap this up in light of the time, but I'll entertain any further discussion if it's urgent. Very well. All those in favor of the motion to that a letter be drafted to support this grant application, is that a fair characterization, Jen?
We need to separate the board and the council.
No, I don't think so.
Oh, okay.
We did that already. That's to accelerate the vote. Now we're just voting on the motion.
Okay, got
Right?
it. I agree.
All those in favor, please raise your hand.
Eight, two. Seven, 3, 4, 5, 6. 7. And then we can't see your hands, Deb and Dwight.
White is two people, so there's actually 8 people on the Zoom.
8. 26. Okay.
26 in favor. All those opposed?
1 on Zoom.
I see. Well, Ann, are you?
Nope.
Frank?
That's opposed on Zoom.
Oh, how
And
many are
Vote.
opposed? All? 2?
2 opposed.
So what's the full vote?
26 to 2.
They voted 26 to 2. The motion passes. Thank you all. We will, thank you. Thanks, Lynn, for coming tonight. We'll now move to announcements. Joanne, I know you had an announcement.
So I understand that next month, the sheriffs are going to have a presentation here. And I want to say if anybody has things they want to discuss about working with the sheriffs, any problems or suggestions, I don't want to get into it now. But if anybody wants to do that, I'd like to gather a small group, meet in the library or whatever, and mention a few things. If you're interested, if you want to do that, let me know. And I also wanted to say, it's so funny because I didn't realize we were going to go into all this today, but I want to say that I've never sat and talked with JC before. And I sat for an hour and a half and talked with him about something very sensitive to me. And I could not believe, and I'm a retired nurse, and I worked in many different departments, but I also worked in psych for a number of years in different facilities. But he had the focus and the heart and the patience to deeply listen that is pretty rare. I mean, really, I can't remember when I last experienced that. It was amazing. And so I just want to compliment him because I didn't know who is he? So anyway, I was blown away, and I just want to thank you so much and celebrate your being.
Thank you, John. It was an honor. Thank you. I'm reminded to mention that next month we'll be meeting at the Methodist Church. The Land Trust will be using this room. Kevin?
Appreciate the meeting. We passed the motion advocating for safe renewable energy. Appreciate the support. Just want to let people know that on June 2nd, we will be meeting with Representative Joe Fitzgibbon, one of the sponsors of one of the bills that did promote nuclear energy in the state of Washington. And the work to get that message across the state is supported very much by the motion that passed here. We're using that as an example when we talk to indivisible chapters across the state of Washington to contact their legislators to express their views about our future energy choices.
Thank you, Kevin. That's great. Steve?
Hi, Steve Bergman. I'd like to thank the community for helping to remove 160 beach tires this year. we beat last year's record of 127, so I'm really pleased about that. However, we want to remind everyone that the pile at Jensen Point is only for beach tires. We've had a number of non-beach tires added to the pile, and the county is not picking up the tires that don't come from the beach. So please, if they'll be picking them up in the next couple of weeks. So if you do have any other beach tires that you see floating around at low tide, please dig them up and bring them to Jensen Point with our thanks.
Thank you, Stephen. Thank you for that work and to everybody involved.
I just want to say thanks to Jen. I have a Vashon-Maury Community Council email address, which is jeff@v-mcc.org. So I would welcome any of you that have passionate issues that you want to make sure are being heard by members of the board. As the newest member with the freshest amount of bandwidth, I'm not burnt out yet. So I'm also currently unemployed, so I have a lot of free time. So I welcome your emails and opportunities to meet for coffee.
Thank you very much, Jeff. Jen?
A few announcements. This Monday, Memorial Day celebrations at 11 a.m. There will be a ceremony at the Vashon Cemetery honoring Vashon veterans. From 2 to 3 p.m., there will be a block party and community barbecue at Memorial Green, which is at 10004 Southwest Bank Road. And there are new regulations going in for homeowners if they have septic who live on the water. There will be a mailer going out to all people who are shoreline property owners in the early part of June. And there's an in-person meeting that's June 18th. I'll set some announcements out in social media, and there's a QR code if this applies to you in your room that's in the back of the room. There's a piece of paper. So you can catch the QR code on your way out for more information.
Thank you, Jen. Ike, did you have something? Are there further announcements? If not, I'll entertain a motion to adjourn. Oh, did you have announcements, Julie? Thank you, Julie.
Motion to adjourn.
Just been motion to adjourn. Is there a second? It's been moved and seconded. All those in favor of adjourning, please say aye.
Aye.
All those opposed? We're adjourned. Thank you all very much.
Laptop is me, so I can actually work at it. Yes. And install